Okay, hopefully everybody can see our slides and hear us. I'm Amanda, I'm one of the ST2s, I'm now at Oxford.
And I'm Nimisha, I'm one of the ST4s working at Reading.
And we're here this afternoon to talk to you about our audit that we did at Reading, where we looked at improving the care of patients with asthma on discharge from the ward by implementing a simple checklist. So we all know that asthma is really common. It affects 1 in 11 children in the UK, causing significant morbidity and mortality. The national review, Why Asthma Still Kills, found that 1 in 5 patients who died from asthma had attended hospital at least once during the preceding year, and 10% died within a month of discharge. An important part of asthma management is therefore discharge care, with the aim of reducing the number and severity of future exacerbations. And one method of achieving this is to utilise a discharge bundle of key aspects of care. So our objectives were to investigate our management of children over the age of 1 admitted with wheeze, and we wanted to see our performance relative to other trusts and identify areas for improvement, with our main focus being the discharge bundle.
So we initially used data collected as a part of the NACAP from June 2019 to March 2021. NACAP is the National Asthma and COPD Audit Program. This is a continuous clinical audit which was launched in June 2019. And it captures the process of care, clinical outcomes of treatment for children admitted with asthma attacks, and also structuring and resourcing of asthma services in England, Scotland, and Wales. The audit program has been commissioned by the Healthcare Quality Improvement Partnership as a part of the National Clinical Audit and Patient Outcomes Program, and it currently covers England and Wales. This program is primarily led by the Royal College of Physicians, but it closely works with a broad range of organizations, including Asthma UK, the British Thoracic Society, Primary Care Respiratory Society UK, the RCGP, and the RCPCH. Our audit aimed to collect information on children and young people aged between 1 to 18 years of age admitted to the wards at the Royal Berkshire Hospital, either with an acute wheeze or an asthma attack. We covered around 158 patients during this time frame. The data was obtained retrospectively from patient case notes and entered into a secure and bespoke audit web tool. So these are the key clinical indicators of the NACAP project, and these indicators were included in the audit pro forma. So the first part basically shows patient demographics and smoking status and exposure. The second section shows recording acute observations in triage. The third part shows mainly acute treatment of asthma and wheeze received in ED. And the last section looked into review, discharge, and use of steroids. And this was the main focus of our audit, the discharge bundle and the elements of good clinical practice. The elements of good clinical practice included inhaler technique being checked, if maintenance medication was reviewed, if adherence was discussed, if a pediatric asthma action plan, that's a PAP, was issued or reviewed, if the triggers were discussed, if tobacco dependency was addressed, if any follow-up was sorted out, and if they had inhaled steroids at discharge.
So as we've just talked about, the first round of our audit was the NACAP data. And following looking at this data and getting some results, we delivered education to the team at Reading, both about what our results were relative to the other centres across the UK, and also talked about best practice for discharge care for patients with asthma and wheeze. We then created an easily editable checklist which could be introduced into the patient's electronic notes with just a few keystrokes, so no IT knowledge was required. And the aim was to start this checklist early in the patient's stay, and then it can be updated on subsequent encounters, so on the ward rounds, we can edit it each time. And on discharge, it's pulled across to the GP letter. It was easy to set up through our IT department and integrate it into our existing electronic notes system. At Reading, we use EPR. It was therefore available for every clinician to access. Our hope was that the discharge checklist would both prompt discussions about the things that we've been talking about, so maintenance medication, inhaler technique, and everything like that, but also make sure that clinicians were thinking about these things and prompting clinical decisions and improving documentation. We also made the asthma care plans more readily available to staff and parents. And having done those three things, we wanted to re-audit the data to assess the effectiveness of these interventions. So we looked at the patients that were admitted with asthma and wheeze between April and July 2021, which was 31 patients. And then it will be re-audited again in the next cycle. So this was the checklist that we created that was easy to insert into the patient's notes. And then it can be edited as required. So this just runs you through all those elements of good practice, and they can be talked about either when the patient's first clerked or on the ward rounds, or whenever it's most appropriate. And then the hope is that by the time the patient's discharged, we've covered all of the parts of this that are relevant, and it's all documented in one place. It's really easy to access and really easy to find out the information.
So coming to the results of our audit. So the light blue color indicates the results before intervention. The dark blue shows results after intervention, and the pink shows the national average. The national average data was obtained from the NACAP audit report, and it covered around 8,506 admissions in a period of 15 months. So initially, Royal Berkshire Hospital was below the national average in several areas and showed room for improvement. However, instead of waiting for the next NACAP cycle, we put the earlier mentioned interventions in place and re-audited our patient notes for 2 months before the next national cycle. And this re-audit demonstrated significant improvements. So the first graph on the left shows that documentation of checking inhaler technique had increased from 36% to 66%, with the national average being around 62%. Discussion of maintenance medication improved from 60% to 90%, with a national average of 69%.
We also managed to greatly improve our discussion and documentation of wheeze triggers. So before our interventions, this was 43%, and after interventions was 83%, with a national average of 41%. And we managed to significantly increase our issuing or reviewing of the paediatric asthma action plans. So before any interventions, this was 8%, and after our interventions, it was 47%, with a national average of 46%.
Coming to implementation of a discharge bundle. So before interventions, we were only implementing discharge bundle in 4% of the patients. This nicely improved to 48%, with a national average of 52%. And number of patients on inhaled steroids at discharge improved from 57 to 59%, with a national average of 71%.
So in conclusion, we did two main things. Firstly, we raised awareness of our previous results and of best practice, and then we introduced a simple checklist that we've talked about, which had a dramatic effect on the discharge care of patients with wheeze. We think this intervention was successful because it involved an easy to access checklist within the electronic notes system, which avoids the previous issues of finding and then losing paper checklists. And it's also easy to add information to as you go along, as it's appropriate through the admission. We're aware that we might simply have improved documentation of conversations that we were already having, although the feeling among the team at Reading is that practice has also improved, and that juniors are able to prompt seniors on the ward rounds to document and complete this checklist as a reminder of best practice. And we also found that it was easy to disseminate this information to the patient's GP, which will help with duplication of work and aid us having clear communication. So in terms of wider conclusions, we found that electronic note systems can easily be adapted to fit specific purposes and improve patient care. And these sorts of projects could easily be applied in other clinical settings. We know that preventing readmissions in asthma is in everybody's best interests. So anything that we can do to improve our rates of readmission would be really helpful. So thank you very much for listening, and has anybody got any questions?
Thank you, Amanda and Nivisha. We've got one question here. So there's a clear positive impact of asthma management on discharge from acute paediatric settings. How can you ensure this continues to be used?
So I think what we've done is we've included this talk, or the importance of this in our junior doctor inductions, because the consultants keep changing every week. The juniors are roughly same for 6 months. So we've been prompting the juniors to just mention it to the consultant during ward round. And it's like Amanda said, it's just squiggle, and the word P, and then the whole thing will come up. So our main thing is to encourage juniors to use it. We also put around small sticky notes on all laptops and computers and around the ward, posters, just to raise awareness among juniors and nurses as well, just to make sure that this is getting completed.
Thank you. And could this be used as a template for primary care?
So I believe most of the primary care services have asthma nurses, and I want to say they probably have something similar to this. The NACAP is looking at data across GP services and hospitals. I haven't gone into the primary care data, but I know they are collecting evidence based on that. And all this information is included in the Pediatric Asthma Action Plan, the PAP, which I believe is usually reviewed during their annual asthma review in the GP services with an asthma nurse.
Thank you. Another question here. Perhaps there is a functionality to make it a mandatory checklist to have been completed as part of the discharge letter when wheeze or asthma is entered as a diagnosis.
Yeah, so that is something that we've been talking about again with the electronic notes systems. There are lots of different ways of getting things into them. So you can have mandatory pop-ups that come up that you can't continue until it's been completed, or as part of a discharge checklist. So there are definitely other options that we're looking into if our rates started to drop again.